Cephalometrics is a shorthand method for description. Statistics is a shorthand method for the description of data. By the use of certain of these techniques, we can begin to interpret the meaningful nature of finding. So modern science deals with variation, and standard deviation is given the term sigma, or SD, and what it really represents is a description of the area of a curve of distribution. Now that number represents then about 68% of the curve, the volume or the surface area of this curve. This is represented then as plus or minus 1. Have you ever been to Las Vegas? Well, the odds. All of Las Vegas is based on chance. And who were the first people interested in statistics? The gamblers. Absolutely. Who would you think in history would be the people who wanted to know? The people collecting taxes. So it got its name, statistics, from matters of state. They wanted to calculate how much people should pay taxes. Who were the third group of people? Insurance companies. I'm going to live to be 103. And I even know how I'm going to die. I'm going to be shot in the back by a young jealous husband. Alright, now here's what I was trying to say a while ago. Our ideal is in here. Anything within this range may be ideal. Then we get desirability and acceptability and then unacceptability. Two standard deviations includes 95% of all the people. This means that you've only got 2.5% on either side of two standard deviations. When you get to 3 standard deviations, it's 99%. For 2.5 years, we had been gathering data. We recalled about 300 patients in 1966. It had been my practice to take x-rays on smaller children, as I said the other day, so that we'd have a growth record. And I took both lateral and frontals. So I wanted to do this study to see what kind of an analysis we wanted to make. So from that I got 70 patients back who had never been treated. So from that group I was able to select 40 patients. 20 boys, 20 girls, 20 class 1s, 20 class 2s. Now that was my sample that I studied. Now prior to that time we had done 2 computer studies already. The first one was a study at the hospital for the occlusal plane in patients which were edentulous. To study the occlusal plane to determine where to put it in a prosthetic case. In that same year we did our pilot study on 20 patients to test some of the methods that we were going to use. Now what I did was to take all of the measurements that anybody had proposed at that time, and there were 262 measurements that were made. We made a cross-correlation of everything with everything else. And when I took time 1 and time 2 and the differences between. So in 1968 I took all of this information after poring over it for almost a year. We had a chalet up in near Arrowhead in California. And I went off by myself up into the mountain. And for 3 days I wrote. I had to make decisions on which of these measurements we were going to use. But if you get 2 stars, you better wake up. And if it's 3 stars, you better watch your fee.
それから星印が3つ
For instance, now let's go back and look at some work that I did. This is the first 1,000 patients that came to me as an orthodontist. All right? This is the way we measure facial convexity. -9.
マイナス9の人がいますね。
-9, and these are up here at about +12. All right, now this is the facial axis.
こちらはフェイシャルアキシスの分布の様子です。
If you notice here now another curve of distribution like so.
やはりこれもそう。
Here's the lower incisor to the APO plane. This is 82 people in the normal sample from the Foundation for Orthodontic Research.
これは
If you'll notice, the mean was 2.5 millimeters ahead of the APO plane. All right, in 1959,
1959年のことです。
I calculated the relation of the lower incisor to the APO plane in my first 1,000 patients that came to me.
私のところに
The mean was 0.5,
平均値がコンマ5。
and the standard deviation was 2.7.
標準偏
Now these had malocclusions.
差が
Down's normals were also 0.5 millimeter ahead.
切り成績
Downs.
ダウン
Dr. Downs' analysis, his average lower incisor was 0.5 ahead, so it was the same as I found in the malocclusion.
低速点
Now when you look at this curve and you look what the normals are,
しかし
we've moved this up to about 2.
しかし
So our objective in treatment is 0 to +4.
そこで我々
Now in your population,
日本人の人口日本人においては
your mean would be a lot higher.
ずっと平
You have a more protrusive denture by nature.
均もともとその
When we talk about direction of growth of the face, we're talking about the chin,
音外のことを言っています。
where the chin's going. When we talk about the behavior of a case during treatment and the mandible rotating, we're talking about where the chin's going. When we talk about extraction, we're usually talking about the limitations that are in the lower jaw. So it's the mandible that receives the greatest amount of our attention in the diagnosis, in the prognosis, in the treatment planning,
の段階でそれから治療計画においても
the monitoring of treatment,
治療
and finally, the results. So that should tell us something.
それで何か
That
が
of all the bones in the face,
すなわち顔面のすべての骨は
it's the mandible that is most important to us.
骨の裏
So we should know everything anatomically about this bone that there is to know.
ところが強力にできている
So where is the heaviest part of this bone?
というのがある
Right through there, isn't it?
ここです
Look at it.
見ればわかる
The
けど
heaviest part of this bone is right in front of the cornoid process. So where's the most common fracture?
よく一番
Right there.
ここです
The angular fracture.
この
Now, this horseshoe shape then has to be strong.
バテ
Why? Because muscles are attached.
なぜならば
At
こ
the
の筋肉がいろいろと
So the mandible bends.
下顎骨というのは曲がるものです
Therefore, it has to be thick
それだけこの厚みがないと
through
耐えられない
here
です
to resist that bend.
こ
The
の
wider my face, the more bracing I have to have here. The wider my face, the more I protrude, the stronger it has to be.
この
This is braced more in the patient that has a wide face. So in the square brachyfacial type, what does the symphysis look like?
したがって幅の広い方がここの部分はサポートが多いですだからブラキオフェイシャルの非
The
常にこ
long,
の
narrow
四
type
角い
face,
顔の人はどうでしょう
long,
か
narrow symphysis.
ということで
I like to think of the mandible as having a central core.
セントラルコード
Central core, C-O-R-E. This is its central core,
これがそうですその芯の部分
starting about here
ここら辺から始まって
and coming down through the lower border
このように下縁のところを通ってお
and
下に降り
coming
て
up
き
into
て
the symphysis.
で結合部ができます
Then coming down and coming over to the other
そして
side.
反対側に行くわけです
That is the central part of the mandible.
これが
I make no differentiation, as a lot of people do, with what is ramus and what is body. In development, this becomes the body. As it grows on the arc,
このアーチでずっと伸びていきます。
This then is simply pushed down into the body and becomes remodeled for mandibular body
そう
bone.
するとこの
All right, from that central core,
で
which is also reinforced on the inside
でこれ
by
は
the mylohyoid ridge,
顎舌骨筋線によって
it also simulates the form of the core.
この
This
形
is a curved bone coming up on the inside.
これは内側のカーブを描いている骨です。
So we have on the outside and the inside this central core right here.
からセット
Now we have 5 processes then that extend from that central core.
でこの
One is the condyloid, one is the coronoid,
それか
one
ら
is the angle,
それからこの嗅覚
one is the symphyseal,
それから化学結合
and the last one is the alveolar process.
それから5
If you
つ目
lose the teeth, you still have the core left. So we'll examine this bone then by starting then with the central core and looking at the processes.
それでは
So we'll start from the inside out.
では内側
All right, pick the mandible up
こ
like
ういう
this.
角度で持ってみてください。内側から見るの。
Pick the mandible up like this and look at it from behind. Imagine this core like the runners on a sled. Notice that the mandibular foramen has a funnel shape.
化学口ですか、失礼。化学口というのはこのロートの
It's
ような
not a
形に
little
なっていま
hole, it's a funnel.
す。小さな穴ではなくてこう上が広がったロート状です。
Why would it be a funnel?
なぜこういった形になっているんでしょうか。
Because the mandible moves,
なぜかというと化学が運動
it
する
has
と
to have a place for the mandibular artery, the mandibular nerve, to move it.
化学神経、化学動
So
脈
there's
が
the space
動
where it
く
moves
余裕
in.
が必要です。だからそのスペースが
It's got a
空い
lip
ていて、
over it.
でその上に動けるようになって上
What
にリ
attaches
ップ
to the
が
lip?
ついています。そのリップの部分、突き出てる部分に何が付着するでしょうか。
What attaches right here to the lip or to the lingula
これリンギュラというリップなんですけども、
at the mandibular foramina? What?
化学口のとこ
What attaches
ろ、
there?
これに付着するのは何でしょうか。
The sphenomandibular ligament.
これに緻密です。
Sphenomandibular ligament is tough.
この靭帯は非常に強靭なタフな靭帯です。
So that's a place that serves as almost a lever right there
こういうふうにてこの運動を
for the
中心と
opening
なる
or
わけです
closing of the mandible. So the mandible opens very close to xi point. So looking on the inside then,
で中から見ると
you come forward and there's a very heavy
さらに
plate of bone,
前方
and this is called the temporal crest.
これが側頭梁かしら
All of
テン
this
ポラルクレスタと言います
All of this coming up here is the temporal crest. And the temporalis muscle attaches all the way on the inside right there.
側テンポラルクレスタ
This area where I have my
で
finger
今私がこうやって持っている部分ですけども
is called the retromolar trigone.
これ
Notice that there's a good bit of space, buccal, to the lower molar.
スペースが
And notice that the third molar is about 1/2 behind the external oblique ridge. So there is space in there for that third molar, distal to the anterior border of the ramus.
すなわち
So we can't forget that when we make a diagnosis of an X-ray.
上映の部分をトレーシングできない。した
Now
がって気を
coming
つけ
up
てやらな
from
くてはい
this
けません。
temporal crest,
でこのテンポラルクレストのところからさら
now
に
there's a division again.
追っていくとまた分かれています。分岐しています。
Notice that the bone is thick up to the condyle and thick up toward the coronoid. Do you all see that?
特に
These are stress lines
これは応
that
力線
join right here, and where they join is point eva.
先
Right
から
above
見て
that
いくわ
little
けです
fork,
でこの分岐しているところのすぐ上なんですけども
you will find what is called a triangular plane. In that area, particularly in younger skulls, you will find vascular channels. That area is the tuberosity of the mandible.
これが化学結節です。
That's where it grows.
ここで成長があるわけです。
They're blood vessels that come from the internal maxillary artery directly over to the mandible, right there. So that is where the blood supply for the growth of the mandible comes.
化学
And if you will notice then, the form of the coronoid
でこの筋突起の形態ですけども
has a curved anterior surface
この
with a handle that points backwards slightly.
で少し後ろ
The anterior border of the ramus right here is very important for us in
Where
our
is
work.
important again?
Notice that this is now twisted.
今度はこうねじれてきてるのが分かります。
So the condyle, this is all flat.
これ全部フラットですけども、
Now we come up in here and the bone gets
こ
twisted.
こまで来てこの骨が角度を描いています。
And we've got a condyle here.
でコンダイル。
Some condyles lean backward, some lean forward.
コンダイルによって後ろに倒れてるものもあるし、前倒しのものもあります。
And it's as if it is the compensatory mechanism
このようです。
to link the condyle with the mandible.
レイ
These stresses now are running down this way.
で応力はこういう形でかかります。下の方。
So this is a strut.
これ
And on the inside,
で内側ですけども、
in this large triangle on the
こ
inside,
の
called the fovea, and it's attachment for the external pterygoid muscle.
ここに
In some individuals, you'll see it hypertrophy. Okay, now let's look up at the condyle. Look at the difference in the condyle here and the condyle here. And this,
この例におきまして右左コンダイルは同じではありません。
this one's pointed,
ちょっと尖っていますこちら側は。
this one's rounded, this
これは
one's
丸みがあります。
hypertrophy. So condyles vary with impunity,
ですから
and they can be remodeled by the influence of treatment or by the influence of function. If we were to take a normal condyle
でじゃあ正常なコンダイルがあったと。
that's well formed,
で綺麗な形になっていて
it will have 4 facets on it.
そう
So this one shows 2 here,
これも面が後ろに2つあり
one
ます。
that's not too thick here and one here.
それからも
So
う
you
1面
usually
ずつあり
think
ま
of
す。
a condyle having 4 facets.
からの
Why would that be?
じゃあなぜそういうふうにそのファセット今面と言ってますが4つあるんでしょう。
Right and left lateral excursion.
右左へ側方運動をしなくてはなりません。
If you draw a line down the long axis of the eminence,
で
where does it come? Here's the long axis of this eminentia right here. Now lay my pencil on it, and where does it come
で
out?
そこからまっすぐ線を引いたらどこに行くかというんです。
Facium. Now theoretically then, if that is a very common characteristic of the eminence,
それが
what is the average angle of the condyle relative to a mid-sagittal plane? 90 degrees
これが
or
90度
the mid-sagittal
ですね。
plane.
正中視上面でそれ
And
に
here's a
対する
perpendicular to it.
直角の
But
線
here's the condyle.
でコンダイルはここにあります。
That's another 20
これも
degrees.
20度になるんです。
So at 20 degree, this is twisted 20 degrees.
で20度で20度
Now I'm going to do this in 20 degree oblique.
斜めから投影したとします。
Gets thinner and narrow.
そうするとコンダイ
Now I
ル
turn it this
これを
way.
20度、回
It
してみ
looks
ま
like a
す。
long, thin condyle.
そうしたら
So there's the difference. Now it's a big condyle.
これを大きなコンダイルですし、こちら小さくなるしというわけです。
Now, if I take a picture of a class 3, I get the image of a long, narrow condyle. If I look at the frontal,
それで真正面のフロンタルの写
it's a
真を見
big
ると
condyle.
前から
The class 3 doesn't tend to tip very much. The class 3 in function
3級で機能下ではこのようなその長板運動はするけれども外側あるからです。
Now we've come up here on the inside to the condyle. Now let's go forward. Now we come into the mylohyoid ridge. And the mylohyoid ridge holds teeth. And it starts and becomes a big triangle.
になります。
Because these stresses come down and blend into the lower border of the mandible on the inside and run along the alveolar process.
で上はそうと
Now we have a plane where the tongue sits.
ここ
And it's usually polished. This is called the planum alveolare, the alveolar plane.
つまり
This is the main support for the lower incisors. Most of the support for the lower incisors
で化学摂氏の指示構造と
comes
いう
from
のは
this plane so that the teeth are suspended.
ここから
This plane is very hard bone. And if you're not careful, when you start moving the lower incisors backward in an extraction case,
で
you'll hit the top of the crest.
でこの小腸にシガが当たって
The bone is thick.
ここはもうしっかりした厚い骨構造で丈夫なものですか
And
ら
what's the danger then? This is the resistance, so the
で
root
こ
goes
の
the opposite way.
相骨
Now, so you see, well, the teeth aren't moving fast enough.
でこれで
I've already got them upright.
で動いてもいいは
Kid
ずなのに
wants to know when the braces are going to come off.
で見て
So I'll give it a little extra force.
もうかけてみ
Now the
ます
tooth gets in this
で
position.
そうするとこんな風になってきます
What's the next thing?
じゃあ次は何が起こるかというとだんだんこうなって
You pull it out of the socket.
そこにあるということです
Now if you notice still further, there's a couple of 2 or 3 nutrient channels.
栄養
Usually 2 right here between the 2 incisors. Those are blood channels.
これは血管が通ってい
And
る
then
と
if you
ころ
notice, you see one down above and below the genial tubercles. See
で
them?
それと音がここにも
2 genial tubercles, one I'm holding the hyoid bone and one I'm holding the tongue. And on either side, right there where my fingers are,
で両側今ちょうど私がさつまんでるとこなんですが
is the digastric. Look at the size of that digastric fossa. So these muscles here are assistants in opening the mandible. And as the mandible opens, they take up to keep the hyoid from dropping back into the airway. They're looking from the outside of the mandible.
では科学の外側から見ていきます
We have a vector coming here, a force vector coming down the long
力の
axis.
ベクトルがこの長軸に沿って降りてきます
The long axis of the condyloid process.
これです
Less evident, but still evident, then it is joined by stresses coming from the coronoid
それ
process.
から筋と
And these come down now into this part of the mandible right here, which is called the Trihedral Eminence. And when you see a mandible from the front in the X-ray, this point becomes a reference point, and we call that AG point. Notice how thick the mandible is right there. Even on the outside. It's thickened on the inside, but it's thickened on the outside
こ
too.
の
As I said, even though it's braced this much, there's still fractures right there at that
これだ
point.
け骨が
When the surgeon does a sagittal split,
でさ
it's right through this part of the bone.
時は
So this is what we use in surgery for sagittal splits.
サジタルスプリッ
Now coming forward to that, you will see a ridge going along above the mental foramina, which is a thickened part of the bone, and this is the buccal plate.
これ
Now, we take particularly advantage of that buccal plate in our techniques.
で
We call it cortical plate
我々はこれをコルティカルプレート皮質板と呼んでるんですけども
because it's based on the outer cortex of the bone.
なぜなら
Notice that the further you go back, the more thickness you have on the plate.
でこの
And we'll be talking about the difference in the anchorage of a first molar at the age of 7 and at the age of 12. There's more anchorage at 7 than there is at 12. In the adult, there's more anchorage in the second molar than there is in the first molar.
でせ
The third molar has more bone around it than any of them.
で
So if you have a third molar available for anchorage, don't extract it and throw it away.
だからもし8番が固定に利用できるんであったらばもったいないですから
In an
絶対に抜かないでください正常
All
は、
right? There. Now there's a ridge that comes down below the mental.
で今は音外口の上のリッジを説明してましたけどもう一つ音外口の下にもリッジが走ってます
And this comes down in a curve,
これは、曲線を描いて降りていきます
and it starts to curve up on the outside at the mental tubercle, one on each side. It continues to go up and terminates at the mental protuberance, or the protuberance menti, which we call PM point.
PM
So where this bone ends and where it starts to go backward
でこの
is right here at a reversal line
このリバーサルライン逆
where
に走ってる線の
ingrowth,
と
no
ころです
apposition occurs and no resorption occurs. By definition, the most anterior curve on the symphysis is called Subgonion. The most downward and forward point on the chin is called Natheon.
音外の
And the most lower inferior border on the symphysis is called Menton.
そして一番
Now, a point at the intersection of the downward and backward point on the mandible is called gonion. This point that we actually use for the lower border of the mandible didn't have a name, so I called it subgonion.
使ってた
This is called coronoid point.
これは
The tip of the condyle, upward and backward, is called condylion. The very tip The most superior part of it I call superior condylion. And the point at the back of the condyle
それからコンダイルの真後
I
ろのと
call
ころ
posterior condylion
これ
or
を
PC.
PC ポステリアコンデリオンと呼んでいます
That's right. All right. Now looking at the mandible from the front,
で、
this whole thing then, this triangle here is called the trigonum mentale.
トライ
And that is more prominent in males than it is in females.
この部分
Immediately above and on each side
そのすぐ上両側にありますけども
is the attachment of the mentalis muscle.
ここに
Above that on each side
で両側でそのすぐ上
is an attachment for the incisivus inferioris,
Is that
the
the
lower
nerve
incisive muscle,
muscle?
little muscle. Above that then is the alveolar process,
その上が小突起
which houses the teeth. You notice how thin it is
で歯がここ
on the
に
labial aspect.
指示されています
It's just a covering of
心
the
底は
teeth.
非常に薄くてただ
Lose the plate and the teeth will last for a lifetime.
ないんですが
The hyoid bone is a replica of the core of the mandible. It's the core without the processing.
このと
The function of bone is a calcified system of stress.
calcified system of
System of stress.
stress
So this is a free-floating bone in the body.
で
It is there simply to serve as a point of attachment for a group of bones that come together right here. Now, why does a woodpecker peck wood?
they're looking for worms
They're looking for worms. They're looking for grubs. They're looking for bugs.
そうです虫を
All
探
right, now, how do they go about it?
すどうやって探すんです
They'll crawl up the side of a tree and they'll listen.
木のところにこう近づいてってまず耳を傾ける
And
んで
they'll
す
hear a bug moving.
そうすると虫の動くのが分かるんだそうです
They make a hole in the wood.
Yeah, I
Wood's
know.
dead usually. They won't go in a real green tree because it'd
元気のいい木の
knock
とこ
their
ろに
beaks off.
行かない
So
よ
he makes a hole.
で穴を開けて
Now the question is, how big a hole does he make?
穴を
So
開
he
け
makes
て
it only big enough for the grub to get out. Now the next question is, how does he get the grub out?
全部
He has a fork in his pocket. Chopsticks. Chopsticks. No, he sticks his tongue out.
舌を入れるんだそうです
And he has a very, very long
で
tongue.
非常にね
Now, the next question is,
まだあります
how does he get his tongue out that far?
どうやってそんなに奥まで舌が入るの
Because he pushes his tongue out, wraps it all the way around the grub, and
ただ入れるだけじゃなくて
he has a long hyoid bone. His hyoid bone is in joints, and the hyoid bone goes all the way around the back of his eyes.
で舌骨がずっと後ろ伸びてって眼下の後ろまで行ってます
So it has these muscles that pull the hyoid bone out of a track around his eyes.
筋肉を
And he can push his tongue out by
引っ張れる
pushing
よう
his
になっ
hyoid
て
bone
ま
that
すそ
far.
して操作が
What's that seem to suggest? The hyoid bone is the skeleton of the tongue.
舌骨というのは舌
Usually you
の
don't
骨
think
格
of
で
the
す
tongue having a skeleton.
外
So the
的などうでしょ
muscle-
うか
The muscles of the tongue all have a base in the back on the hyoid bone, on the cornus of the hyoid bone. Right? So what holds the hyoid up now? If the
No,
tongue
that's
is
what's
attached, what's holding the hyoid? What have we already mentioned before? The stylohyoid muscle.
それから形状舌骨筋
Now what else holds it up? The stylopharyngeus, because it holds up the whole side of the walls of the throat. And what's
そ
another
れ
one?
も支えてま
What's
す
the main one? What's the biggie? What's the big one?
もっと大きなものが一つあるんですけど何でしょう
Digastric.
そうです顎に腹筋です
The digastric comes from under the mastoid, comes down, and how's
ず
it?
っとの下からずっと来て
It goes through a stirrup, through a loop
でループをくぐってきてます
of fascia. And it goes down the hyoid, and then it goes up to this part of the
舌
chin.
骨の下のところ来てここまでお隣のところまで来て
So by contracting here, it's like the
でここを
tight rope that the circus walker will be on.
されるわけです
So it can play as the mouth is open.
で遊びもあります
This
開け
one's
れば
contracted. This
こっち
one
が収縮して
is contracted.
でこう
As
やる
it
とこっち
closes,
が収
then
縮
it can move.
して でこ
So
の動けるようになってるわけです
it's in a slip off the hyoid bone.
そういう
So
ふうに
that,
我々は
that
機能
holds
してる
up
ん
the
です
hyoid, which holds the tongue up.
これで
So when we study the hyoid bone,
だから舌骨を勉強するときは
we are studying the movement of the tongue.
実は
There are a number of conditions that we can see. We will be talking about the different heights and the significance of the hyoid bone. In glossoptosis,
下に垂れちゃってるって感じ剣
when you get older, your belly drops,
重力に逆らえ
your
ない
fanny drops, your boobs drop.
あ
So
の
when you get old, your jowls hang, you know. You begin to droop, you begin to fall apart.
年を取ると何でもこう下がってきますけどそんなもんです
And also, in older people, the tongue drops.
高齢者の場合には舌も落ちて
We
きちゃ
call
うんです
that a ptosis.
これをこの状態をトースし
In
て
a
るんです
condition of a cerebral accident, stroke,
で例えば脳溢血の時なんか
they lose these muscles, or they lose the innervation of these muscles.
こういう筋肉の神経支配
And
が
the
なくなって
hyoid
しまいま
bone
す
and the whole pharynx drops
そうする
down.
と咽頭全体が落ちてしまうんです垂れてしまいます
So it is a clinical condition that is well known.
これは臨床的な状態としてよく知られている現象です
But we also see the opposite of it.
その逆もありますその下に垂れるのでは
A
な
tongue
くて
that doesn't descend properly and
Tongue
remains too high because at the embryonic stage the tongue is all the way up into the nasal cavity. So patients that have a high tongue usually have a tongue that's forward also. And they usually have spacing in the denture. And so part of successful treatment is to get the tongue down a little bit. If it's a glossoptosis, the objective is to get the tongue up.
グロソプトーシスならば逆に舌をもっと上に持ち上げてやらなくてはいけないと
So these are physiotherapeutic techniques that we would use. So we are interested in the posture of the mandible. We're interested in the hyoid bone. We're interested in the inside because that makes up the oral environment. The walls of the denture are the tongue on the inside and the lips and cheeks on the outside. These are our permanent retainers.
こういった
And if they aren't in harmony, you have to hold an artificial appliance in there forever. We'll look at some principles and some methods here first. This lecture will include 6 parts. We'll talk about methods of investigation of growth in the past, some fundamental principles of growth,
2番
growth before birth, the original concepts of Brody and Broadbent, the computer findings and some of the current findings,
5番
and finally break it down into the components. The first is direct measurement. The second is putting implants in, or having an ankylosed tooth, which is an implant. Inlow studied histologic bone, and the surface and internal characteristics reveal how it had grown. Dried skulls have been used. Another technique is vital staining. And in an evolutionary sense, then we can study how development takes place. Finally, then, our tool is cephalometric rentgenography. But let's first look at some general principles.
それで
You can't have growth without an individual cell growing first. In the beginning, the function of all cells is for growth. So all of the progenitor cells that we have are for the purpose of growth only.
全て